duct right here is the parotid duct. This is the parotid gland. Right here, this is the submandibular gland. These are the lymph nodes. Okay, and if you look inside, this piece right here that I'm pointing at, that is the sublingual gland.
It's underneath?
Uh-huh.
Okay.
Okay.
And this one is the submandibular duct. Okay? And the gums, this part at the point right here, that would be the oral vestibulae. These are the external nares, which is the nostril. It's on our terms list, but we didn't look for it. In here, this is the hard, is it plate or palate?
Palate.
I keep saying plate. Okay.
I do too.
Hard palate. And then this is the tongue, but the parts that point out, this is the lingual tonsils. The part that attaches at the bottom, the skin, which I cut by accident, that is considered the lingual frenulum. And then the arch right here would be the palatoglossal arch. And then, let's see.
Right? What about the duct? The duct?
There's no duct. There's only two ducts up here.
Wait, it's like a whole palate.
Yeah, palatine tonsils are right here. See this? That's the palatine tonsil right there.
Hold on, look at that.
See that?
Watch that later.
That's the palatine tonsil. Okay. Soft plate, palate, soft palate. And then this part, the opening, that is the auditory tube canal. Inside is the nasal pharynx. I think, I'm sorry, it's auditory tube opening. And then down here is the esophagus. Okay? This liney thingy, that's the trachea. This shiny part is the thyrocartilage. And then this part, the duller part, is the cranial cartilage. The C rings that are white are the tracheal cartilage. Okay? And then right here, these are the thyroid glands.
Okay.
Okay?
We were trying to look for that yesterday.
There's one right here too, but it's deeper down. And then right across from here, you have to look at it later. I don't know what the name of it is, but this part here, this is actually the cranial thyroid vein or artery or duct. I don't remember if it's which one it is, but it's right here. It's going to go across. And now we're going to open it up. Okay. Okay. This part right here, I can't really point it. Can you use a probe and hold it back so I can show you? Hold this part back. Just hold from right here. Okay. This part right here, this is the epiglottis. The actual opening is the glottis, and then down here is the trachea again. The little like hump things right here that come out, there's one on this side too that are cartilages. Those are the arytenoid cartilages. The first laying right here that's a little bit darker, those are the false vocal cords, and then down here is the true vocal cords.
Wait, where?
False vocal cords are up here, and then true vocal cords are down here. They're really close. Just know the false vocal cords are on top. It's like the little layer right here. And then we're going to go down. Okay. The shiny layering over here, this is the parietal parietal pleural. And the covering on the heart and stuff, that would be the visceral pleura. And the cavity in here is the pleural cavity. The heart sits in the mediastinum. And there was a clear attachment up here that we took off, which is the mediastinum septum. This is the thymus up here. And then these are the lobes of the lungs. I'm going to go through it really quick. So this is the inferior of the right, middle of the right, superior of the right. And down here, which is in between a very small one, that's the right accessory lobe of the lung. So this is the left side, superior left lobe, middle, left middle lobe, and then left inferior. And then this is the diaphragm right here. All right, okay. The greater omentum, which is the fat, the spleen. All right, sorry. Okay. The very, very bottom one, that is considered the caudate. This one right here. That is the caudate. And then it's the one after that is the lateral of the right. So right lateral lobe of the liver, and this is the medial lobe of the liver. The one right here, which is where the gallbladder is sitting on top of, that is the quadrate. This one is the left medial lobe, and then left lateral lobe. Yes, thank you. Okay, this is the stomach. Inside would be considered rugae. And then right here, if you look at that, this part is the pyloric region. The pyloric sphincter is right here. And then coming out, that's the duodenum of the small intestines. Right here is considered the body. And if you get deeper down in here, the top curve is considered the fundus. And then the sphincter right here is the cardiac sphincter. And up here would be the
Curve of that.
the top curve of the stomach, which is like right here. That is the fundus. And then the sphincter up here is the cardiac sphincter. Up here would be the esophagus.
Oh my gosh, I would have picked nothing over there.
And then small intestines. Inside would be the villi. Okay. And then kidney, spleen, kidney, liver. This is, okay. Back here, it's hard to tell, but this is where the pancreas is. Okay?
Wait, where is it? Can you point at it again?
This is the pancreas.
Okay.
Okay.
No. Well,
No, we have a female cat. They have the male cat over there. Yeah. Okay. Up here, that is considered the tail end. So the tail end is actually facing towards the heart, and the head end is facing towards like the babies and like the foot. So just remember it's reversed.
okay.
There should be a pancreatic duct, but that's not going to be on the model, which we can look at that later. And then the clear stuff right here is considered the mesoduodenum. So all this clear stuff is mesoduodenum. Okay? And then for here, like the small intestines, these are the mesentery proper. And then if they're nodes, then it'd be the mesentery.
Wait, then, hold on. What's the duodenum again? I thought
This is
that
the
was-
mesoduodenum, where the pancreas is.
Okay.
So it's thicker. Okay.
And then there should be mesentery lymph nodes here, but I don't know, can't find it.
Yeah.
And then down here are the this is the mesocolon. Because it's where the colon is.
Okay.
Also descending colon. Okay, and this is the transverse if you turn it this way. Hold on. Okay. And then right here would be the ascending, and this is the cecum, and then the, sorry, let me redo that. Okay, so ascending cecum ileum.
Wow.
This layer is the parietal peritrilineum.